I'm Dr. Mix, remember like Cake Mix from West Plano Pediatrics. And this video is for our new moms and dads and parents out there, a continuation of our newborn baby care series. So today we are going to review what a healthy baby should be doing and some red flags of when to call your pediatrician. So what do babies do? Their main job is to eat. That's all they're doing. At first, they're cluster feeding. The average baby, if they're breastfed, will feed 10 to 12 times in that newborn period. So they are feeding on average at least every 2 to 3 hours to bring that mom's milk in. And we'll go over this more, but if they are not feeding and they are not sucking, something may be wrong. That's like running on a treadmill for a baby. So that could be your number 1, 2, and 3 reason to call me. If your baby is not feeding well, whether it's at the breast or the bottle, then you need to call. Okay, what else do they do? Babies poop, and they poop a lot, especially a breastfed baby. Almost every time they feed, they're gonna have a poop. What can be a red flag though is when you are breastfeeding, maybe your milk is not coming in, and if you see a decrease in the number of stools, that could be an issue. And so you also need to call your pediatrician. A formula-fed baby should be pooping as well. If you are not seeing them pooping, or they are straining or having hard stools or blood in their stools, that could mean that they have a formula intolerance and they are having an issue. You should call your pediatrician. What else do they do? They sleep. They sleep a lot. The average baby, newborn baby, probably sleeps about 16 hours a day. So that's what they do, eat, poop, and sleep. It's a vicious cycle. Somebody will come home and say, what did you do all day? I don't know. They just ate, pooped, and slept. So it will all run together. So it's okay if they're sleeping a lot, but you do kind of want to get them on a little bit of an on-demand schedule or a regular schedule where they're feeding on average every 2 to 3 hours or so during the day, especially for a breastfed baby. A formula-fed baby might feed about every 3 to 4 hours during the day. If they're having nice stretches of sleep, that's probably fine as long as they're waking to feed. In general, in the first 2 weeks of life, I usually recommend to my parents, especially if they're breastfed, don't let them go longer than 3 or 4 hours to feed, or about 4 hours in a formula-fed baby. If they're too sleepy to feed, if they're not waking to feed, there may be a problem. Maybe they're getting too jaundiced, very yellow, and it's causing them to be too sleepy to effectively feed and either transfer mama's milk from the breast or to take that milk from the bottle. Or maybe they have a heart condition and that's why they can't feed well. So if your baby is not feeding well, that's another reason to call us. And that's why we also follow those babies very closely in the first 2 weeks of life. All right, now we're gonna go over some red flags, some other reasons to call your pediatrician. A big one, of course, is fever, okay? We're gonna go over in another segment after this of how to take a rectal temperature. Fever is defined, depending on the textbook you read, but in general, it's defined as any temperature greater than 100.4 degrees Fahrenheit or 38 degrees Celsius, okay? Bottom line is, rectal temperature is best for your baby's core temp. However, if you don't have a rectal thermometer, I'm not a big fan of the forehead thermometer or the pacifier thermometer. You need to let your pediatrician know that's how you took the temperature. So let us know what the number is and how you took it. Did you take it rectally? Did you take it axillary? Did you take it here? Did you take it there? And let us know what the number was. Don't add a degree, don't subtract a degree, don't do anything crazy like that, okay? Second red flag is, again, poor feeding. Let's go over this a little bit more. A lot of parents use the word lethargic. I do not like that word because that means literally that your baby is not waking to feed, too sleepy to feed, and is like a limp rag doll. So when you tell the pediatrician that, remember that a bunch of red flags are going off in my brain. But poor feeding is a baby who really won't wake to feed. They don't have a good, strong suck. So if your baby had a strong suck before at the breast or on the bottle, and is now taking forever to feed or weakly feeding, or it's just dribbling out of his or her mouth, that is a problem, okay? So, and they should also, it'll be reflected in the fact that if they're not feeding well and they can't take that volume in, their poopy diapers are gonna go down, and especially their pee-pee diapers are gonna go down. Especially in that newborn period, they should still be peeing probably every 8 hours. And if you're not seeing that, we need to supplement, or we need to see, are they having an effective suck? Is mom's milk in? Are they able to take the bottle? What is going on? So that's sometimes when a baby is first getting sick, They may not have a fever. The first red flag might be that they stop feeding very well. Another red flag, inconsolable or inconsolability. Yes, babies cry, and they cry a lot. They cry for all kinds of things. They're mad, they have a stomach ache, they have air in their tummy, they're hungry, they want a diaper change, they want to be held. So you're going to start to differentiate your baby's different cries in the first couple of weeks of life. All babies cry, and sometimes they have these fussy periods or these witching hours at night. Sometimes between 9 p.m. and 2 a.m. they'll cluster feed and cry. But if they're really crying after 2 hours or 2 to 3 hours and nothing is working, you've swaddled them, you've held them, you've fed them, you've burped them, you've changed them, you've taken a car ride, all of these things, you should call your doctor. It might just be a really bad tummy ache, it might be severe colic, but we need to triage that. All right, next red flag, vomiting. Notice the color that I made this. All babies spit up. All babies have some degree of reflux, but true vomiting is where they start to vomit after every feed. Their wet diapers again go down, and the puke should never be this color. That would be bad. That is called bilious emesis. You need to call us immediately, ASAP. Might be an obstruction. Next, promise we're almost to the end. Here's a big one, labored breathing. What does this mean? Babies do funny things. They do what I call puppy dog breathing. It's really, the medical term is periodic breathing, where they'll kind of go, breathe fast, slow, fast, slow. That's normal. If you're not sure, you can take a video, send it to me. But if they are having difficulty breathing, usually actually, they won't be able to feed well because they can't coordinate their suck swallow. 2, if they're really having distress, respiratory distress, they're gonna breathe like this. It's gonna just be rhythmic, and it's not gonna go away. It's gonna be up, down in their chest. They're gonna be pulling and tugging right here above the sternum, retracting, or they might be retracting in between the ribs or right here. And they're gonna breathe over 60 to 70 times a minute. And if you're counting that and you're seeing that, you should call us right away. And everybody's got an iPhone or an Android or whatever. Take a video, because I can, screen that over the phone or even over the telehealth. Also, another thing they'll do is if they have a lot of mucus and all of that, they will be choking on their mucus and their phlegm, and they won't be able to breathe. So we'll teach you in another video how to clear their nose and their upper airway so that they can feed, okay, with the bulb suction. So again, labored breathing. Also, the worst sign is their head starts to bob and they start to grunt like this. Those are all big time red flags. Call us immediately. If your baby is turning blue or you're really scared, call 911. Finally, that wraps it up, friends. Go see my session on rectal temps and suctioning, and call us at West Plano Pediatrics anytime, 972-608-0774. This is Dr. Mix, Like Cake Mix, signing off.